Thank you for your interest in participating in our study, comprehensively profiling social mixing patterns in workplace settings to model pandemic COVID-19 and influenza transmission and control, also known as corporate mix. This research study is led by Yale University, Emory University, and the Centers for Disease Control and Prevention. Respiratory diseases may spread from person to person through contact with mucus or saliva expelled when an infected person coughs or sneezes. We want to conduct this research study to understand better how diseases such as COVID-19 and flu are passed from person to person so that we can learn how to prevent transmission of these diseases. Seasonal influenza, also known as the flu, is a disease that causes fever, headache, tiredness, cough, sore throat, nasal congestion, and body aches. In the U.S., the flu season normally runs between the October and May months. The severe acute respiratory syndrome, coronavirus 2, also known as SARS-CoV-2, is a novel virus that causes coronavirus disease, or COVID-19. In addition to these flu-like symptoms, individuals with COVID-19 also experience loss of taste or smell, cough, shortness of breath, and sometimes diarrhea. In the U.S. alone, it has infected more than 7 million people and led to more than 200,000 deaths. Workplaces are an important place where respiratory diseases are spread from person to person. For instance, about 1/3 of influenza transmission occurs in the workplace setting. This study aims to collect data on social contact and interaction patterns among employees either working at the office or from home. The study will use this data to model interventions to reduce transmission of respiratory infections such as COVID-19 and influenza in case of a pandemic. We are excited to partner with Guidehouse on this important project, and we would like to invite you and your colleagues to participate. Your participation will be a step towards the goal of protecting the United States workforce against respiratory disease. Participation is voluntary and will take about 30 minutes of your time. If you agree to participate, you will first be asked to complete an enrollment survey to collect basic data about yourself, such as age, sex, occupation, marital status, and household composition. You will then receive a link to 2 online contact diaries that will ask about your social interactions with other individuals over 2 consecutive workdays. In the contact diaries, you will be asked to enter the duration, frequency, and the proximity of your encounters with others during the 2 days. You will also ask about the contact's age and gender, as well as where the contact took place. A social contact is defined as a 2-way conversation with 3 or more words exchanged in the physical presence of another person. We will also ask some questions about flu and flu vaccine. Please ask or email the study staff questions about anything you do not understand. Once you understand the study, and if you would like to participate, we request you to electronically sign consent before completing the surveys. Also, you can change your mind at any time. Whatever choices you make will not have any effect on your relationship with your employers or coworkers. There is no cost to you to participate in the study. In appreciation of your time, you will receive a $40 gift card after you complete the contact diaries. Your survey information will be kept fully confidential. Only the researchers involved in the study and those responsible for research oversight will have access to the information you provide. We will share it with others only if you agree to it or when we have to do it because U.S. or state law requires it. When we publish the results of the research or talk about it in conferences, we will not use your name or other information that could identify you. If you have any questions or if you have a research-related problem, please contact either Dr. Ben Loatman at benjamin.allen.loatman@emory.edu or Dr. Saad B. Omer at saad.omer@yale.edu or at the numbers listed below. All this information will also be listed in the electronic consent form. Thank you again for your interest in our study. We hope that this experience will be gratifying for you. You can also take pride on the fact that you're contributing to critical public health research while also learning how to protect yourself and others from getting infected. Thank you.